To start off the assessment, we'll start from the least invasive to the most invasive, also from head to toe. We'll start by taking the baby's temperature in the axillary position. A normal range for a temperature is 97.7 to 99 degrees Fahrenheit. Now we'll be moving on to measuring the circumference of the infant's head. The average circumference of the infant's head is 13 to 14 inches. Now I'll be assessing the head of the infant. I will be assessing for the facial features, making sure the eyes are in line, the nose and the mouth are in the midline, and the locations of the ear, if they are located below the eyes, could indicate abnormalities. Next, I'll be assessing the fontanelles. We have two fontanelles. We have the anterior fontanelle and the posterior fontanelle. The anterior is a diamond shape and the posterior is further back. I'll also be assessing for molding of the head, which is commonly caused by vaginal deliveries. Before moving on to the thorax and chest, we're going to be assessing the neck. A normal neck should be short with folds. Now we're going to be reviewing the thorax and chest, just the portion that we're assessing. I'm going to be assessing the alignment of the nipples, the breast tissue, the symmetry of the chest movement, and breath sounds. From here, I should be able to count respirations. The normal rate is 40 to 60 beats per minute. Along with respirations, I'll be taking the apical pulse here. I'll be auscultating for a full minute. The regular heart rate for a full term is 110 to 150 beats per minute, and for a preterm, 120 to 160 beats per minute. I will also be assessing for any signs of respiratory distress. This includes nasal flaring, grunting, sighing, or retractions. Moving from the chest and thorax, we're going to be assessing the abdomen. It's important to be assessing for any abdomen distension, and especially the cord stump, which should contain 2 arteries and 1 vein. And also from here, we're going to be auscultating for bowel sounds. And then we'll be moving on to the extremities. I'll start with the arms first. I'm going to be assessing for symmetry, range of motion, flexion, and muscle resistance. This can also be carried out to the legs. We're going to go ahead and cover baby's upper half and expose the bottom half to keep baby warm. Again, we're going to be assessing for the symmetry of the legs, flexion, range of motion, and muscle resistance. Now I'll be assessing the bladder and bowel. An infant should urine within the first 24 hours. We'll also be assessing for the first stool called the meconium, which is a black terry stool. We're also going to be assessing for signs of bleeding. For females, it could be pseudomenses, and for male, it could be relating to circumcision. Palpations of the testicles should be performed. Next, we'll be looking at baby's back. We're going to keep baby covered and warm. Turn baby on its side. We'll be looking for any Mongolian spots, which is usually seen on the buttocks, flat blue discolorations. And we're also going to be looking for sacral dimpling. From here, I'll be getting baby's height. The average height is 19 to 21 inches. We start from the top of the head, work our way down to the bottom, and all the way down to the heels. Next, I'll assess the neuromuscular functions, and I'll start with the lower limbs. First reflex here is a plantar reflex. Simply put your thumb under the toes and the toes should curl. Next is the Babinski reflex. Run the end of your pen or your finger on the bottom of the feet and the toes should flare. The next two reflexes involves the upper half of the body. The first reflex is called the root reflex. Simply brush the side of the cheeks, corner of the mouth, and the baby should turn its head towards that stimulation. Next reflex is the suck reflex. Put on a pair of gloves, put your finger in the baby's mouth, and the baby should start sucking. And that is it to my assessment. Thank you very much.